Good morning. I wanted to get on live today just to tell you about this experience I had yesterday here at the clinic with a patient, in the hope that this information helps you with your own healthcare, but also someone that you love who may be struggling or suffering with back pain or leg pain or sciatic pain. And even so far as someone who is waiting for surgery or going through the medical model of wait and see approach until things get bad enough for surgery, and to not do any conservative management, because this stuff frustrates me a lot in clinical practice. So I'm gonna start off this Wednesday morning with a little story for you, because I had a patient return yesterday, and she's been out of the country for a long time. She was in about a year ago, and she had a really bad low back, and she was on and off a cane because her leg was going numb. She was losing leg function. So for those of you who know about the nerve system, the nerve from your low back goes down your leg, and it's called the sciatic nerve, the big one. And when it starts getting in real trouble, you can lose leg function. So in essence, this was happening to her, and so we started some care, which was going well, and then actually she left the country. She was left the country for a big chunk of time. While she was away, she decided to line up an MRI of her low back, which was great. We had some x-rays which showed us exactly what was going on in her low back. So we had a great action plan, but the MRI definitely gave a lot more information about exactly the discs and the nerves that were getting compressed. So with that, from the sports medicine, she went into a surgical consult with an orthopedic surgeon for the low back. And of course he looks at the pressure on that sciatic nerve, and he does his testing, and he goes, well, yeah, you have pressure in your sciatic nerve. You are not a surgical candidate right now, because they would run a nerve conduction velocity test. So the nerve was actually getting the signal through okay, but obviously not at 100%. There was enough pressure that she would hobble around on a cane with sciatic. And then the frustrating part came, because obviously she came back in the clinic, because even after that surgical consult, she's struggling. She's not a candidate for surgery, so what the heck does she do? Not a great position to be in if you have a problem like that. But the surgeon said, don't let anybody touch your back. Don't do any physio, any chiro, any massage. We will do a follow-up in 2 years. We'll do another nerve conduction velocity test. When the pressure is bad enough, then we'll consider surgery. And that kind of non-conservative management of your spine frustrates me, because we get great results in this clinic with chronic low back pain, with sciatic pain, with chronic hip pain, any of those nerves that are coming out of the low back into the lower half. Well, we can take pressure off through specific chiropractic adjustments, and sometimes take home exercises or take home traction units. Because I thought of her case, and I thought of another man. He's a bit older. This lady was in her 40s. This gentleman was in his 70s, but the same thing applied. He was in about 2 years ago, hobbling around with sciatic, numb leg, chronic leg problems, chronic back problems. And his surgeon had told him the same thing. He goes, you know what? Don't do anything about it. Enough. Come back for lumbar, low back surgery. And it was interesting, because both of these people, I said, really, well, if they advise you to do nothing, well, what are you going to do? But they were both in the office looking for an alternative to getting pressure off their back and their nerve system and getting healthy again. And it was great, because I know his story really well, And it's such an awesome story because this gentleman does travel a lot, and just did this amazing long trip, including big hikes in the Middle East over the winter. So I mean, his leg function is, I would say, 100%. Like, he's doing great. So he went from kind of wait and see till surgery to, hey, I can still travel the world and do these amazing long hikes. And so that's why I wanted to share this story today, because the lady who came in yesterday, very similar story. She didn't want to wait and see and watch her leg get worse and her back get worse, and then the pressure on her nerves grow, and then all of a sudden she's back on a cane or in a wheelchair for a while, and then she's under the knife to open up that low back to take pressure off the nerves through surgical intervention. So that frustrates me a lot, because the whole thing in the literature is there is amazing conservative management of the spine, right? Whether it's neck, middle back, low back, there is an incredible amount of research and evidence that chiropractic care can help, because ultimately we are physicians who are primarily concerned with the structure and the function of your spine. For those of you who don't know a ton about chiropractic care, on this hand we have structure. What does your spine look like? What is kind of the architectural integrity looking like? And then on this hand we have function. How is your spine moving? And what the research shows us is if you have good structure and good function, you live with a healthy spine. And if you live with a healthy spine, then you live with a spine that does not have nerve pressure happening, like the sciatic, the numb leg, does not have back pain, neck pain, headaches, migraines, numb arm, numb leg, throwing your back out, cricking your neck, all these little things that people experience with spinal pain. So that was my little story for today on live. I hope you get a little bit out of that. If you know someone who's struggling with chronic low back pain or any kind of numbness, tingling, sciatic pain, there's a ton of help available. You just have to understand what to look for and how to fix it, and that's exactly what we do here. If you have any questions, shoot us a message through Facebook or personally, Martin Zollinger. I'll answer you any way I can. Even if you live far, far away from us here in Ottawa, I'll be able to refer you and find you someone in your area who can help you manage your spinal complaint. So happy Wednesday. I hope you all have an awesome day, and I will see you very, very soon. Take care.